A first of its kind social medicine housing program here in the Parkdale neighborhood is seeing progress on a goal it set out 1 year ago to improve lives and address high volumes of emergency room visits.
For many persons who have seen their life experience connected to that revolving door of going to an emergency department, to having chronic pain, to now have the experience of having less pain and more community, that has been the story of Dunn House.
The project was developed by the city in partnership with the federal and provincial governments, University Health Network, and social services organization Fred Victor. According to Dr. Andrew Bazzari, there were over 3,000 emergency department visits in 1 year by just 50 to 55 UHN patients. But since the opening of Dunn House,
what we've been able to see in the last year is a significant impact on emergency department visits from people who've been living here, a 52% reduction, 79% reduction in the amount of hospital length of stay or bed days that we're looking at from the year prior to people moving in.
Here at Dunn House, there are 51 studio apartments for unhoused individuals also facing chronic and complex health conditions. Now, this housing initiative also gives residents access to supportive services and permanent housing.
I can tell you stories of some of our patients who are now residents at Dunn House who no longer have to visit the emergency centers, departments, but they now have a community space that has been created.
Fred Victor provides residents with services like cooking programs, one-on-one counseling supports, opportunities for individuals to be connected with family, but most importantly, the organization builds an environment where residents feel at home.
When you look at the health consequences of homelessness, people who are chronically unhoused live half as long as the general public.
And Dr. Bazzari says that when you look at the cost breakdown, it costs over $30,000 a month for someone to be in a downtown hospital and less than $4,000 to house people.
And so when people ask, can we afford more Dunn houses or scaling more of these options? When you look at the cost breakdown, I think the question is, how much longer are we willing to afford the status quo?
In Toronto, Rhianne Campbell, City News.